Hello, everyone. It's Janine Taylor, District Health Department number 10. I've started recording this call, and I'll turn it over to Dr. Morse to give her update.
Okay, welcome everybody. I know there's a lot of changes and things going on, so we'll get right into it. Oops, let me share my screen here first. There we go. All right. So you should see that all right. If not, let me know. Just a reminder, this is for school and health department staff. And so if you're a parent or someone else, these recordings and information will be on our websites in 1 to 3 days. We just ask you drop off so that we can dedicate our time to question and answers for the schools. Just a reminder, make sure that you pass down any information to secretaries, school nurses, and anyone else who may need it in your departments. First, we will go to the data. Just done that to begin with. Just do that. So, just run through our areas here. We are seeing quite a bit of increases throughout our territories and throughout the state, just kind of a gradual increase. Remember, if we're in the medium high to the highest category, those are the areas that we do recommend students who have symptoms get evaluation prior to return to school, just because the risks of community transmission are high enough to have concerns for exposure. So in Central Michigan District Health Department, which is Aranac, Clare, Gladwin, Isabella, Osceola, Roscommon, all of those counties are in those risk categories. I averaged out the entire district's daily cases per million. It's at 47.7. Last week it was at 31. The percent positivity average is at 2.5. Last week it was 1.5. So you can see the gradual increase. I did go through and look at the cases for each individual county. Aranac really has not had many cases total. They've just had about 4 cases within a week. So that pushes them up into a higher count because of their smaller population. Clare has had 2 very tiny outbreaks, again, smaller population, but definitely seeing more and more cases being reported from Clare County. There's really not a major specific pattern other than just a couple cases associated with a couple of locations. Gladwin County, again, they're also seeing quite an increase in cases without much of a pattern. Isabella County, if you take out CMU's cases, you're left with half the number that they have listed here. And this -2 means that over the last 2 weeks, the cases have consistently gone down for 2 weeks, and the positivity has gone down for the past 2 weeks. So that's what that means. Osceola, there's not really been a pattern, and Roscommon has had one really tiny outbreak that's accounted for about 1/4 of the cases. In District Health Department 10, all but 3 counties are up in the medium high to very high risk groups. Again, if I average out the daily cases per million, it's 53. Last week it was 33. 2.6% of tests are positive. Last week it was 1.6. So again, overall seeing increases. Looking at Kalkaska and Wexford, there's really not much of a pattern with their increases in cases. And again, really there's not a large number of cases overall. It's just there's smaller areas there. Manistee has had some cases from Ferris State and a nursing home outbreak. Lake County has had really a very tiny number of cases. It's just, again, they've happened within a short period of time, and it's a small population county. If You look at the cases in Mecosta County, about 40% of them are related to Ferris State. So if you take those out, it will drop the number quite significantly. Newaygo, a third of their cases are related to school outbreaks and farm outbreaks. Oceana, about a quarter of their cases are related to a school outbreak. Mid-Michigan District Health Department, they are all seeing pretty significant numbers of cases. Again, they went from 60 cases per million to 94, and 2% positivity to 2.6% positivity. And they're having quite a few outbreaks. So about 40% of Clinton County's cases are due to outbreaks in schools, colleges, nursing homes, different group functions, parties, things like that. Gratiot County, almost half of the cases are due to outbreaks in different locations like adult foster care, churches, schools, colleges, and Montcalm. About a quarter of the cases are related to a large school outbreak. So at this time, no one's really at a point where you just need to stop in-person classes because of the community rates. However, if you are having sustained transmission within your schools, you're getting spread within your school, we can discuss what is the best action. So again, if we go back to our matrix here, you know, we're kind of in this C or D area. The schools that we have in the D areas, again, many of them have some isolated outbreaks. So if we kind of take those out of the picture, really most of us are in the C area. And so we can keep doing everything with our strict mitigation measures. And if we have outbreaks or sustained spread, then we really look at further action like pauses in education, which really many of the schools that have had those situations have done that without much difficulty. So we'll get back to our PowerPoint. So I put a list here of all the schools. It's really pretty much everybody but 3. And it never hurts to err on the side of caution because, you know, even if you're in one of those 3 counties, your area around you is seeing some significant increases. So I'm going to shift into the changes. I'm sure everybody is aware the Supreme Court ruled on Friday that the executive orders were no longer applicable. There was a legal review, and I put the link here, that they are still in effect for 21 days. There's been questions about that, so I know it's still kind of going back and forth. But the suggestion would be to just consider that they are in effect till October 23rd. The roadmap was really enforced by an executive order. However, the plans that you created were passed and approved by your school board. So those really are in effect because your school board has approved them and it's part of your school plans now. So you would really have to look to your school board to change those should that be the wish of your school. We really would encourage you to continue following that and continue following the recommendations in the roadmap, as that really gives good guidance on COVID prevention in your schools. Earlier this week, there were emergency orders made by Director Gordon, the director of Michigan Department of Health and Human Services, under the Public Health Code. This code gives the director and our health officers some very broad powers. It's not limited to a state of emergency. It really is a very firm and indisputable authority. So there really shouldn't be any issues with this. But just as a brief review, it allows the director or the health officers to make emergency orders to control an epidemic, make orders to prohibit gatherings of people for any purpose, and establish procedures to be followed during an epidemic to ensure the enforcement of health laws. That's basically kind of a catch-all that says whatever needs to be done can be done. And this review from Yale really goes over that really well and really says that there are very broad authorities with this. There are abilities to penalize people for violations, and there are abilities to utilize law enforcement for this as well. So again, this is a very real way to help continue with these policies. And there's some review of the public health code at this link as well, if you're interested. So the emergency order for gathering prohibition and mask orders was done, I think, Monday. It was the 5th. And so in a nutshell, these are the things that will affect schools. Gatherings are permitted without regard to the size limitation for students in a classroom setting or children in a daycare setting. So there are other limitations set. I'm not going to go over all those, but they don't affect students in a classroom setting or children in a daycare setting. For organized sports, for those who are playing, it's not going to affect it either. I think that might be a little confusing, but there's no size limitations for those playing sports. During the competition, your live audience is limited to 2 guests per athlete, or if you're indoors, they must be wearing a face covering. And if there's fixed seating, 20% of seating capacity. If it's not fixed seating, 20 persons per 1,000 square feet. If it's Region 6, which we do have some Region 6 counties, that goes up to 25% or 25 per 1,000 square feet. If it's outdoors with face covering, if it's fixed seating, 30% of seating capacity. Without fixed seating, 30 persons per 1,000 square feet. So that's the gathering information that pertains to school situations. Face coverings, basically any indoor location, including schools, must not allow indoor gatherings of any kind unless they require individuals to wear a face covering. For Region 6, face coverings are recommended for schools. So again, the public health recommendation is that masks should always are always preferred, but they've kept it kind of the same as what it was in the roadmap here. The second part of that is you may not assume, so you'll sometimes see those signs on stores that say, if we see you not wearing a mask, we'll just assume you have a health problem. You're not supposed to do that. So you're not supposed to assume that someone who enters without a face covering has a viable exception. The thing that's different here, though, and I only know what I'm reading from this order, we haven't had a lot of clarification yet, but schools and everybody else may accept an individual's verbal representation that they aren't wearing a mask because of a specified exception. And I'll go over the exceptions in a second, but one of them are medical reasons. So this is specifically saying that you can take their word for it, whereas before we were requiring notes from doctors. However, there's nothing that says here you can't have your own policies. So if you're requiring notes from doctors, you can continue to require notes from doctors as far as I can tell. I mean, there's no reason why you can't have your own rules. This is just something that very specifically says schools can accept verbal confirmation that they have a exemption. So exemptions, so go back to this. You must not allow anyone to gather unless you require them to wear a face mask, unless they have one of these exceptions. So if they're under 5, so again, this is going to affect then all your students, K through 12, which was set to happen anyways. If they cannot medically tolerate a face covering, and that's the extent of that comment, there's no list of what those are. When you're eating or drinking, if you're exercising outdoors and consistently maintain 6 feet of distance, so if you have outdoor gym class, or if with recess kids are staying 6 feet apart, which I know is tricky, swimming, getting a service where you have to take off your face covering, for identification, communicating with people who are deaf, deafblind, or hard of hearing, and you need to take it off for communication. Public safety officers who need to take it off to perform public safety responsibilities, polling places, officiating or engaging in religious services, and giving a speech for broadcast, and you can stay at least 6 feet away from others. Now, I know this question might come up, but giving a speech for broadcast or to an audience, I personally would not consider that teaching. To me, that is doing an interview or speaking to an auditorium. This is not, to me, school. The other thing here, talking a little bit more about organized sports, it does state that athletes that are training, practicing, or competing must wear a face covering other than for swimming or consistently maintain 6 feet of social distance. So that's very similar to what it was before. And it does state in there that sports organizers should follow the guidance of MDHHS, whether and how sports can be played safely. That's the same guidance as was there before. The guidance still says that contact sports should be avoided at this time. So we've already discussed that, but that still is in there. And no concessions are to be sold at indoor organized sports. So those are the parts from that emergency order that pertain to schools. Of course, there's other things in there, but that's the main things that pertain to schools. Then there's the emergency order about reporting confirmed and probable cases. This starts on Monday, the 12th. This really is not anything majorly different than what you've been doing. It just adds an additional public notification, a posting on your website about cases. So we at the local health department must notify you within 24 hours of school-associated cases, which they list as any confirmed or probable cases among students, teachers, staff, coaches, volunteers. So basically anyone who was on your school property or at a school function that could have caused transmission of COVID within the school. We also are responsible for providing direct notification to people who are or suspected to have been close contacts. It doesn't say we're responsible to identify them because we don't really know who those are because we don't know the class schedule, things like that. But it does say that we are ultimately responsible for notifying them. The school then, within 24 hours of the time that we notify you, you then within 24 hours must provide a public notice to the school community, which may include teachers, staff, coaches, volunteers, parents, in a highly visible location on the school's website. So what they mean by a public notice is new and cumulative counts of school-associated cases, including the date on which the school was notified of the new case, not necessarily when the person became symptomatic, when they were diagnosed, which would really discourage you doing that because that can actually cause people to figure out who that person might be and can cause some privacy issues. We just yesterday got an email where MDHHS provided us with some templates. One of them, and we'll send them out to you. One template was this, and it's a suggested letter you can adapt and then post on your website. Whenever you get a new case, you can just edit it, and it has your cumulative cases, the new cases, and it has the other information you need to change to fulfill that obligation. The other thing you can do is, the letter you send to your parents, you could just tweak that a little bit to include this information and then just post a copy of that on your website. So hopefully that won't be too much of an extra lift for you. You can incorporate that into your notification you're doing. They also included a draft of a general notification letter to help with notifying the parents and teachers and everybody else. I'll forward that to you as well. We've already provided you with some template letters and the communication guide. So you can then have kind of your choice of whichever letter you like better. But you should already have some options like this at your disposal. They provided some other templates. One was worded a little confusingly. It was about potential exposures. And again, it's very similar to this. And one was a letter about symptoms, a letter you would give someone if they had symptoms. I can share it, but it has wrong information in it. It says to have them stay out for 14 days when really it should be 10, because symptomatic people should stay out for 10. And it says for adults and children to stay out for 14 days. It doesn't say anything about, getting tested or anything like that. So my inkling was to not share those with you, just because my opinion is they're more confusing than useful. This is a good lead-in. I'm getting a lot of questions about this still, and I just wanted to review it. This is the algorithm for staff and adult workers or volunteers screening. With adults having one of the major or two of the minor symptoms, having them not return for 10 days, really without the or if they test negative statement in there, and why that is. I just wanted to review it again and provide a little more information. So where this comes from, the CDC recommends, and this is in their employer-employee section, employees should not return until they have met the criteria to discontinue home isolation. That's if they have symptoms. There's really nowhere that they say, or if they have a negative test. And I'll down here explain why that is. They also say in their student screening section, students who have received a negative test result should be allowed to return to school once their symptoms have otherwise improved. So our recommendations follow these guidelines. You as a school, if you want to alter those guidelines, you can. So if you want to allow teachers or other adults with negative tests to return to work, you can make that your policy or go on a case-by-case basis. But just some things to keep in mind. Adults are likely more contagious and more likely to spread illness than students. Mainly our younger students, but that's why we're a bit more cautious with symptomatic adults. And the false negative rates of PCR tests can be quite high. So if I was exposed today to somebody with COVID and got infected, my test today would be negative. And it would be 100% false negative, even if I was infected. If I waited 4 days, there'd be a 67% chance I'd get a false negative result. On the 5th day, it'd be 38%. The 8th day, it'd be 20%. This is if I have symptoms. And so that is one of the reasons is you could have someone symptomatic on day 5 after they were infected, have a negative test, and it's over a third of a chance likely it's going to be a false negative. With children, the odds aren't, we're not quite sure of the false negative rate in kids, but they're less likely overall, even if they are infected, to infect others. So again, that's the rationale behind it. We totally understand the troubles with finding staffing though. So again, it's up to your discretion to make those decisions of the risks, benefits of having people come back before those 10 days. We can't really say, oh, it's okay to do that for obvious reasons. It's, something happens and we've given bad advice. And we've given advice that's just not technically correct. So I hope that makes sense. The other thing, the CDC had just recently updated this and made it a little more colorful. But this is a nice table that compares symptoms of COVID. Here's all the symptoms of COVID with strep, colds, flu, asthma, and allergies. And we'll send this out with the other materials we send out today. I just was going to touch on travel again because I know that comes up pretty much every week. I just added more information. This is from the CDC's website. It just says that some travel, there's still no real official recommendations for quarantine after domestic travel. The CDC just says that some travel is higher risk, and if you do higher risk activities, take extra precautions for 14 days after you come home, which they say is stay home as much as possible. They don't say quarantine, they just say stay home as much as possible. Stay away from high risk people, consider getting a test. High risk activities are being in an area with high levels of COVID, which there's a specific list for international destinations. They say that you can also check state, counties, and cities to determine if the areas have high levels of COVID. I added in this note here, they do have a link to a data table for the CDC, but it's not very good. It gives total numbers of cases rather than cases per population. So if you have, 10 cases in Rhode Island versus 10 cases in Texas, those are a little bit different. So this website has a bit better way of presenting the data. I've given it before, and the orange and red states, and then they also have it by county, are the higher risk areas. Going to social gatherings, mass events, being in crowds, which they even mentioned in a restaurant. So anybody who travels is going to be in a restaurant. Traveling on a cruise ship or a boat, they would consider a higher risk event or activity that you might consider doing this. So again, that really is the most specific information that we have on travel. We at the health department don't require quarantine after domestic travel. So I just wanted to share that. So at this time, I can open it up to questions. Maybe.
Dr. Morse, I'll start with the first question given. Number one, it says, we are having many parents telling us that physicians won't see them unless they have a fever, even with other COVID symptoms. How do we handle this in regards to letting them return back to school?
So one thing is there are locations that will test without doctor's orders. Not all of them will test children, but they can go to either call 211 or go to michigan.gov/coronavirus test and find a testing location where they can just go and get tested. They can take them to urgent care, but we kind of knew this was going to be an issue. I mean, healthcare providers are just a bit overwhelmed right now. But seeking out just a testing facility may be the quickest and easiest way to go about it.
Okay, next question. What does, quote, have an evaluation, unquote, mean before returning to school? Does it mean getting a COVID test?
So it's either getting a COVID test and or seeing a doctor or healthcare provider and being diagnosed with something else that explains those symptoms. So if you have a sore throat and fever and you see a healthcare provider and they diagnose you with strep, or you have a fever and abdominal pain and get diagnosed with a bladder infection, that's having an evaluation.
Okay, next question. Are they not requiring child care centers to have students wear masks either?
So according to that, it says that those under 5 don't have to. I know they're still in the process of trying to create the epidemic orders to replace what the emergency orders have left gaps in. Laura, and I'm not as knowledgeable about the child care rules and orders, but Laura had rules and orders as well. And the licensing requirements were separate from executive orders. So if the licensing board says you have to do this to be a licensed childcare facility, those still stand. I just have to admit that I am not as up to date on those as I am with the school materials.
And Dr. Morse, would it be that those that live in Region 6, the masking is recommended, and those that live elsewhere, they're required, except for the under 5 and under?
For school, that is what the epidemic order states.
Okay, next question. What is the cycle threshold for PCR tests conducted in our health department region or state, if you know? If not, can you get us this information?
I don't know, and it depends likely on what healthcare system facility you're getting the lab done at. Seems like it's when I was reading articles on that, it was quite some time ago, but it seemed like it was a pretty standard thing.
All right, next question. Could this public notice take the form of a link to a document that is updated with new cases, or does it require a new posting for each case?
So are we talking about the Excel document?
Chris Ming, feel free to hop on and...
Yeah, so the thought that I had was to create a single running document that I update with the information. All the information contained, 'cause like up until today, I hadn't seen any type of sample or anything to go off of. So the idea is to keep a running document that the link is on the website there for everyone to click on whenever they want, but not necessarily trying to draw attention to every single new thing with a new blast or a new post or this or that. Just it gets put onto a single document.
I guess I'll defer that to my website people. I don't have any preference how we share it.
So if it's something that is a document that is housed on your own website, then yeah, you can certainly provide a link and have people go to that link and just see, check it as they want. But is this a document link that's on our website that you're talking about? I just want to make sure.
It would be a link on our district website, and it would just open up a document that I have the ability to edit behind the scenes with new information, but it would be a link that would always be there on that website.
My opinion is that's a great idea. I think after a while to have to update and, like you said, blast out information, if you educate the parents that they can always go at any time to click on this document. The only challenge is if you do it in Excel, not everybody has Excel. If you do it in a program that not everybody has, there may be a challenge. But yeah, I think that that's a smart way to do it.
With Google Docs, I mean, they all have their own unique URL. So it's just a matter of putting the link on there. And it's opening up a URL for a view only for people. And
Right.
I just have to draw unnecessary attention. Obviously, we're still going to be releasing the information and in letters and that type of thing to our families, but it's a single document that's just there and I update as necessary. If that meets the qualifications, then I think that might be the best way of going about it from my seat anyway.
I got what you're saying. I misunderstood what you were asking at first. Yeah, they just say that you have to post it in a public notice in a highly visible location on the school's website, and that it has to have the new and cumulative counts. It doesn't say how to post it or what format to post it, but it just has to be posted in a highly visible location. So, you know, if you just had a little window on your front page of your website that said, click here to see our COVID counts or something of that nature, and then it went to just a doc that you just edited, I don't see why that doesn't fulfill the obligation. But it has specifically says a highly visible location on the school's website.
And do they need the words public notice, Dr. Morse? Because I know for our public health department, we have to use the words public notice.
Yes, it says must provide a public notice, and then it's defined. Public notice means providing the new and cumulative counts of school-associated cases. So that emergency order is a 1.5 pages long. It's pretty self-explanatory to read through it, and it explains pretty clearly what is needed. So.
Okay, next question. Are licensed child care centers such as Head Start and GSRP required to post this information as well?
So I believe it only refers to schools.
Yeah, Doc, it's schools. It's only schools. Public and non-public schools is what's referenced.
So I would say no then.
Okay, next question. Are we required to post the number of people impacted by each COVID case on our website? I noticed the template you shared had the population impacted listed under the cumulative cases.
All it says is that you have to provide the new and cumulative counts, including the date on which the school was notified of the new school associated cases. That's just the template that it provided. The population affected, next to it, it says staff, staff or students, not necessarily, the number of population, but which, did it affect the football team? Did it affect staff only? Did it affect staff and students? That I don't think is a required thing. It's not listed anywhere that's required. But I think it's probably just something they put on there because you tend to get questions about that. But again, I would go to that emergency order and read it because it really clearly explains what you need to do.
Next question. If a staff member has 2 of the symptoms, headache and diarrhea, they stay home one day and it clears up, can they return to school the next day? Do they need a note from a doctor or to quarantine for 10 days?
According to the CDC, the employees should not return to work until they have met the criteria to discontinue home isolation. So they need to be 10 days from the onset of their symptoms and fever-free for 24 hours and symptoms improved. Again, it's your discretion if you would like to let them return sooner than that.
All right, next question. So students and their families that go away on vacation out of state, should they get a test or isolate before returning to school? Do we need to verify the area that they were at?
That is to your discretion. There are no formal recommendations to do that.
Next question. If you have a district with multiple buildings that are physically connected, would an outbreak of one building require the closure of both buildings?
So we usually take those things on a case-by-case basis. If the buildings are connected and you have students frequently traveling throughout all of those buildings, we'd have to look at that. Or if you had a teacher that teaches classes in both buildings and they are the one that is sick, we'd look at that. But if there's no connection of the cases between those two buildings, typically only have a pause or a closure in the building with the affected cases or the close contacts. So it really just depends where the cases are, where the close contacts are. Was there a sports team? Was it the high school building, but the sick high schooler helps the middle school volleyball team, so they're all close contacts and somebody else got sick? It just depends on that. So those are often a case-by-case determination, and we'll help you with those.
Okay, just to confirm, our data must include both student and staff cases. Also, for the cumulative data, is there a time frame for how long it needs to accumulate?
So all I know is what's written in that order, but for us, cumulative is from day one and goes on forever. So cumulative is every single case that has occurred. My assumption would be, and I don't think anyone had any cases last year, but it would be for this school year. So I go from the first day you had school, and yes, it includes students. It includes anybody who is associated with your school. Anyone, so they define what the school associated cases are. Probable or confirmed cases among students, teachers, staff members, coaches, volunteers, or any other person who was present on school property or at a school function under circumstances that may have resulted in transmission or contraction of COVID during their infectious period. That's a school associated case. And all those, the first section of this order are all those definitions.
All right, next question. Our elementary principals have a question about Halloween. While I know that a previous meeting addressed Halloween, as this approaches, are there any restrictions to in-class parties or wearing costumes, etc., from public health that have changed?
As long as you are following your safety plans, I mean, it's up to your school how you want to handle that, but I mean, you still need to follow your safety plans, and kids need to be wearing their face coverings and maintaining their distancing, and watching what types of snacks and treats are brought in from the outside and that kind of thing.
Okay, next question. Does a district that lies within two different zones need to follow the most restrictive zone guidelines?
Yes.
Okay. Next, I know that you said if a doctor diagnosis is provided for strep, should allow them back. However, I was informed that strep and COVID are going together right now, and that if you have strep, you should be tested for COVID. What if their doctor will not test for COVID?
What we're seeing is some cases where people are positive for strep and they don't get better after a few days. And so they go back and they get tested for COVID and they have COVID. And I'm working on a notification to healthcare providers. So basically what it is they're carriers for strep. So they're not actually infected with strep, but their strep test is positive. It's not that they go together necessarily, and it's tricky. If someone has a sore throat, a fever, and nothing else, and is positive for strep, and they're a child, you know, odds are they have strep. If they have a cough and a stuffy nose, it's not typically strep. So it is very challenging, but that is just where you need to take the advice or the diagnosis of a healthcare provider. With strep, they should not return until they've been on antibiotics for 2 doses or 24 hours. They should be improving by that time. And so if they're not feeling any better at all, you may consider having them stay out longer and make sure that they are getting better. And if they're not, then have them reevaluated. But you're not expected to be a clinician. So if you're told they have strep and they can come back in a day, you have to just go with that. And the majority of time, that's going to be right.
Okay. Students who are quarantined as close contacts of a positive case should be evaluated before returning to school at the end of their quarantine period? Question mark.
They need to have been symptom-free for that 14 days. They don't have to see a doctor. They don't have to get tested. They don't really need anything else. The health department or our contact tracing helpers are following them throughout that time. And if you need a note to release them from quarantine, we can provide that, but they do not have to be evaluated after that 14 days. In fact, we ask that you not bother their healthcare provider for that because they are so busy right now. We can help you with that.
Okay. Next, are weight rooms open for school use?
Was that the question? Are they? I guess that's up to the school. You know, obviously that's for most schools, that's a pretty tight area. But if they can manage it so that people are not less than 6 feet apart and they're wiping them down between use, it's up to the school.
Okay. People monitoring do not have to be reported, correct?
I guess I don't quite get that question, but I'm guessing monitoring as a close contact. Bob, can you clarify that?
I've seen that.
No, they're not a close contact. They were told to monitor because they're not a close contact. They're more like a contact of a contact.
Okay, so we do have situations where, let's say somebody was sick and went to church. And so we let the whole church know, hey, you might have come in contact with somebody. We want you to just self-monitor. So basically we're just saying, you know, actually pay attention a little closer than normal because most people just kind of ignore themselves most of the time. They're not reported. We don't usually know who they are. They don't have to be in quarantine because, again, their risks are considered quite low. It's just that we can't really rule out things. So no, they're not reported. If for some reason there's concern that they truly were a concerning close contact to somebody, you can give us a call and we'll investigate it further.
All right. Last question. We have a child and parent that tested positive for parent was tested for COVID, but why wouldn't the child get tested?
Again, I don't know what different healthcare providers are thinking, but it may be because strep is less likely in adults, and it may be that the parent had other symptoms besides just sore throat and fever. So, and honestly, a lot of healthcare providers don't like doing COVID tests on children because you have to be a bit mean to them by sticking something to the back of their nose. And they feel, well, if mom's positive, then we'll just assume kid's positive too. Those are all thoughts. Again, I wasn't there and I don't really know the full situation, but that's just a thought.
All right, I have another question. Where are the requirements for the dashboard to report positive cases?
Do you mean in the emergency order that I was just talking about, or something different?
I just wanted to see, I think someone just sent me the link though. I think I'm good now.
What I can do is I'll put the links for the emergency orders in the PowerPoint, so that you have them there. I know they tend to
Thank
not
you.
forward them to people, so the people who need to know can't actually find them. Oh yeah, I see Jackie's email there, but I'll put them in the PowerPoint as well.
I assume this, because we're a college, I assume this applies to us as well.
You know, it just says,
School.
it does say public and non-public schools. I can't remember. Steve, do you remember if it said K through 12 or anything like that, or if it just said, I'll open it real quick and see.
It just refers to school, public and non-public.
Yeah. So I would,
safer to do it.
yeah,
Okay.
I would say so.
Do we have to report the people we quarantined or just the
No.
positive cases?
Only the confirmed and probable cases. And a probable case is someone who has been around a confirmed case and then has symptoms. But those will be ones that we notify you of. So,
Okay.
and it really just talks about the ones that we notify you of. So if you hear through the grapevine someone saying, oh, so-and-so has COVID, did you hear? You don't need to report that. Wait until you hear from us and we let you know those things.
Okay. Thank you.
Yep.
Okay, we do have another question. What is the purpose of showing the chart comparing flu, cold, COVID, et cetera, if we're requiring isolating and testing regardless?
I just thought it might be helpful for you, especially in the counties with lower incidence where you don't necessarily have to test everybody. And in terms of, you know, do they need to see their doctor? Should we just tell them to get tested? And if you're trying to decide whether or not you want to make all your teachers get tested before they come back, if you feel safe about that, what you want to do. So.
Okay, it looks like that was the last question in the chat box. Does anybody else have any questions that they want to add to the chat, or just unmute yourself and ask? Is there anything anybody else would like to add? Any experiences or anything you'd like to share? Oh, we got another question. Regarding the daily screening form, if a person has symptoms in the past 14 days, they have to report that even if they've been out for 10 days and no longer have that symptom?
Oh, you cut out a little bit there, Janine. Is that written in the box?
Yeah, it's the last one. It says, regarding the daily screening
Oh, there it
form,
is.
if a person has symptoms in the last 14 days, they have to report that even if they've been out for 10 days and no longer have that symptom? Question mark.
So obviously you can use your own judgment on that. And if they report it, it doesn't mean you have to do anything about it. So. So if they put down that, yeah, I had a cough 13 days ago and you know, okay, that they've had COVID and they've recovered, you can just make a notation on it if that's the case.
All right, any other questions from anybody on the call? Well, Dr. Morris, I think that may be it. Just a reminder that again, these meetings are now every other week. This meeting was moved to 3 o'clock because of a call that took place at 1 o'clock today for some schools, but the remaining meetings, the next one will be 2 Thursdays from now, and it will be at 1 o'clock. We'll go back to our normal time. And again, every other Thursday at 1 o'clock.
All right, guys, hang in there. I know it's been an interesting week. We'll talk to you in a couple weeks. Thanks.
Thank you, everybody. We'll make sure to get the recordings on our websites here shortly.